So to find the radial nerve more distally, it's usually easiest to have the arm sitting slightly on top of the chest and internally rotated just a little bit. And you'll plunk the probe just above the elbow, and you'll find the radial nerve wrapping around the humerus, which you can kind of see here. So this is a reasonable place to block it, is at this particular point. We can trace the nerve more distally. I'm just going to straighten the arm. I'm going to increase the depth just slightly, and then we can follow the nerve a little bit more down the arm. So again, here's radial nerve. We'll follow that radial nerve. You can see it wrapping around the humerus there. And now it's going to start bifurcating, and we can follow the more superficial branches, which become the radial sensory nerve. And it's just located right here. You can see it's can get quite close to the artery, in kind of the mid forearm. Eventually it will kind of separate and go more distal. I'm going to change transducers, and we'll scan it with a ultra high frequency, which will give you a bit better view of that superficial radial nerve. So I'm just going to start a little bit more distal. So here is the radial nerve at the elbow, which you can kind of see here. Basically, it points to the vein up here. So you can see the vein. Okay. So there's the radial nerve at the elbow. Okay. And as we scan down, we'll follow it. So again, it's here. So we're going to follow it down, and we'll follow the radial sensory branch. See, it comes up, sitting quite close to the radial artery there, and then it's going to go off a little bit further laterally. So again, it's here. And there's that radial sensory nerve. The main thing to note about nerves is they are basically composed of two things. They're composed of connective tissue and neural tissue. The neural elements of the nerve will show up as hypoechoic little circles, or give it kind of a honeycomb appearance. And the connective tissue will be hyperechoic in echo texture. So if you see something that's got that kind of honeycomb appearance with multiple hypoechoic little circles, you can be confident that that's usually a nerve.